Watson, fabulous pediatric mama practitioner in this town. We love you. She's a chiropractor. Been doing this work forever and ever and has lots of cool stuff to teach us. So thank you for being here. I'm so happy to be here. I'm glad you're here too.
Thanks for having me. It doesn't feel like I've been doing this forever and ever, but it's getting a little bit closer to that, I guess. I've been in practice for 9 years. My first 2 years, I was an associate at Portland Chiropractic Group, where I trained under another famous pediatric chiropractor, Louise Hewitt. And then I left and opened my own practice called Whole Mom, Whole Child in Northeast Portland. So I've been there for 7 years. And my practice is almost exclusively focused on moms and babies. I had my first baby when I was halfway through chiropractic school. And so that really changed my focus as a chiropractor and practitioner, and it really changed my philosophy about what women need. The chiropractic school that I went to, and I think it's the same as most, was very male dominated. I started in a class with over 100 students, and there were only 16 women. So there weren't a lot of pregnant women, there weren't a lot of babies, and most of the teachers and most of the other students were male. And so when I got pregnant and they were trying to practice on me and talk about how to treat pregnant women, they didn't know what they were talking about, and they didn't know what they were doing. It just wasn't taught. And so I learned a lot of things firsthand from my experience in the clinic of how the traditional approach no longer worked for me, and how it wasn't complicated, but there needed to be some modifications. And I really quickly learned who I wanted to work on me and who I didn't want anywhere near me. And now I go back and I teach at the school. I teach the adjusted portion of the OB class and the pediatrics class. And it's just one day for each quarter for each of those classes, but I feel like there's enough little things that I can tell them about how to do this from what I've learned from myself and now from the clients that I've had for the last 9 years. So a huge passion piece for me is postpartum pain. Pregnancy was really hard for me. I have 3 kids. Each time there was, the typical aches and pains and things that come up, and I already had some issues beforehand, and those got aggravated, and so, there was a lot going on, and I definitely needed body work. But I expected that, and I think many people, when they're pregnant and they're having back pain or issues, they expect that. They don't expect it when they're postpartum, because nobody's talking. They're told once the baby comes, the pain will go away, they'll feel better, or they won't be told anything. They'll go to their 6-week postpartum. Are you still bleeding? No, you're not. Great, you can have sex again. You're good. And that's it. We don't have a lot of follow-up from mothers. And I see mom after mom after mom come in and say, I am hurting. I've run marathons. I've swam rivers. I've never been this kind of sore. I've had medical doctors come in tears saying, I think I must have fibromyalgia, or I must have cancer. There's something wrong with me. I'm really hurt all the time. And I say, no, I see it every day. And I want to get that word out there. I want people to know that this exists. And so I thought, well, we have to call it something. So for now, I'm calling it postpartum pain syndrome. I don't like to focus on the pain piece, but I feel like this is what might get the attention of doctors and get into the literature. When I first developed this presentation, I went to OHSU and I went to the chiropractic college, and I scoured the literature looking for anything on postpartum back pain. And I found quite a few studies on pregnancy-related low back pain, and some pregnancy-related low back pain that lasted into the postpartum period, but nothing about this. And this is what I saw over and over again. So I'll talk more about that, but what I want to focus on is recognizing this in a client, helping them not only with what you do in your office. I know that we all come from different disciplines and different approaches, so I'm not going to focus so much on the specific, hands-on that's different to our individual practices, but I would love to hear about that part in the discussion section. I want to learn from you guys what you're doing to help moms and what you've seen in your experience, because I really want to write about this and get this out there. So this is my friend Lisa from high school, and when I first developed this, I asked people for pictures, and I thought this was so classic. I see this all the time. The babies, the toddlers on the back, and the babies in here, and they're carrying the thing, and they're holding themselves in weird positions. She's not thinking about herself or her ergonomics. She's just trying to take care of the babies and get through the day. And that's a big part of the reason why they're hurting. So my favorite artist, she's local, Katie Bergren, did these paintings, and I like to give her a little shout out when I do these. But this quote just really struck me. I was really changed, like I said, both as a woman and as a practitioner once I became a mother. And I feel like that has helped me in my work. But the piece that's missing for a lot of people is if they haven't been through this, they may not know. And I don't know how many of you are mothers and how many of you aren't. And I'm not saying that someone who's not can't understand, but I really, when I go and I teach at the school and I'm talking to men, I say, you know, if you don't know why she's hurting in these places because of the different activities she's doing, because you've never done it before, it's your job to find that out. It's your job to learn about that. That's how you can help them more. But those of us who have been through it definitely have a little bit of help because we've lived it ourselves. So this is the culmination of years of this floating around in my brain. And I have handouts of this. I don't know if I have enough for everybody. If you want it, I can also email it to you. But is there a little laser pointer on here anywhere? So at the top we have motherhood. So many different things that go along with that. Of course, you have the hormonal changes. Moms in the postpartum year still have loose ligaments. And I would love to talk more about that with any of you who have more information on this. People ask me all the time, how long is my body going to be unstable? How long am I going to be loose? And I don't have a great answer to that. When I looked at all the medical literature, it says relaxin goes down within 72 hours, and the postpartum body returns to its pre-pregnancy state within 6 weeks. And I laughed out loud because it never returns to its pre-pregnancy state. We all know that. But it's just not written about. So I've heard people say, you know, it's not just relaxin, maybe it's oxytocin, maybe it's, you know, other hormones, it's, you know, estrogen and progesterone, those can contribute to ligamentous laxity as well. But I really feel like I see moms still feeling unstable a year, 2 years, 3 years, 4 years postpartum. I'm now 4 years postpartum from my last child. I was pregnant and nursing her both for 10 years and 4 months. And I'm just now feeling like I'm kind of returning to normal. And it's been, you know, probably a year and a half since I've been nursing. So I don't know the scientific answer to that, but I really don't think anybody does because I've looked for it. If you've seen it, let me know. I haven't looked lately. But you have hormonal changes, and I'm telling you, they're still loose in their ligaments. So they're holding all of these abnormal postures, breastfeeding and diaper changing and baby wearing and co-sleeping, but they're doing it on loose ligaments. So when they're bending over like this, their ligaments are holding their spine. They're so much more prone to injury. And you might think it's only, you know, a couple minutes at a time, a couple minutes here, a couple minutes there, but when it's all day long, it really adds up. So I had someone who had really chronic low back pain, and no matter what I was doing, it wasn't helping. And finally, I had this aha moment of, so tell me about your diaper changing setup. This was really early in my practice. And she said, oh, well, I have a little ottoman that I change about. Oh, okay, so you get down on your knees and you're on the floor and bending. Oh, no, I just stand and I just do it like this. You know, so asking those questions and figuring out what is it in their life that's perpetuating these things. You know, that's not particular to chiropractic, but any of us can do that. So, you know, talking about ergonomics, talking about perpetuating factors is really important. And really educating them because they feel like they're getting their body back, you know, they don't feel unstable, they don't feel vulnerable necessarily, but they still are. And letting them know that they need to be really gentle with themselves because of this, and that it's, you know, known, documented thing that they're still prone. So along with hormonal changes that cause ligamentous laxity and lactation, and both of those are leading to the abnormal postures, motherhood itself and the things you're doing, we also have decreased sleep. That moms don't sleep as much. That's in the literature. I'll show you later. There's some great quotes about how it's well documented. So they're tired. And they're tired and they're not holding themselves properly. The fatigue, the abnormal postures, the laxity, all of those lead over here increased susceptibility to injury. We'll talk more about why these postures cause tight muscles, why ligamentous laxity causes hypermobile joints that are unstable. That leads to compensatory tightness of the muscles, back to increased susceptibility to injury, and all of these things week to week. So it makes perfect sense. I think it's a recipe for disaster. You have loose ligaments, abnormal postures, decreased sleep, decreased self-care, decreased professional care. Of course you're a wreck. Of course you're hurting. Let's get these women in, let them know they're normal, let them know there's things that we can do. There's lots of other practitioners, lots of other movement classes and body classes that can help them, and lots of things that they can do for themselves at home. And we can get them feeling better. Obviously, there's also postpartum depression, and everybody knows about that. And I think that there's a huge link between the two, but I have so much to say about this, I can't even go there. So I'll let Wendy Davis talk about that piece of it. Someday I would like to see the connection between the two, because I definitely, there's definitely a huge connection between depression and pain, but it's something that we just can't get into. I just don't want to not acknowledge that. So, yes, we have studies. It exists, postpartum pain. But the ones I've seen, so 23 to 77%, mostly focused on lumbopelvic pain. Few, if any, have been investigated cervicothoracic pain specifically. I see most moms complaining of the upper back and neck pain the most. And I'll talk about that when they come in during the end of the pregnancy. We're all focused down here, and I say, don't forget you need to come back after the baby comes. Then we're going to have all new stuff to work on up here because you're doing this all day. And that makes a lot of sense. So one piece that is really important to me in terms of patient education is injury prevention. And the worst injury that I've seen in practice requiring surgery is lumbar disc herniation. It's been 9 years, thousands of patients. I've had 4 patients that needed surgery for disc herniation. I've seen many more herniations that we were able to treat. But the ones that were all bad enough to need surgery, all 4 of those patients were second-time moms in their first year postpartum. I don't think that's a coincidence. Obviously, that's a big part of my population, so it's not necessarily representative of the population. But because they're second-time moms, and third and fourth, we go even more, I think all of the things that we talked about in the flow chart are still there, but you have that added factor of the toddler, the 2 or 3 or 4-year-old that they're still picking up, carrying on their hip, carrying on their back. That many more toys to pick up off the floor, that much more laundry to do. It just adds that much more stress. So it's usually, they said, I had the baby in the sling and the 3-year-old was running away and I had this sudden movement, and that's when I felt that snap. So I really want to talk to those moms before that happens. It's even more important for them to be really careful about their body mechanics, teaching them how to get that car seat in and out of the car, how to lean over to change diapers. All of those things is really going to help prevent that from becoming an issue, because it's really horrible to have surgery when you're in your first year postpartum and you have to call that house and you have to take pain medication, and you're supposed to stay on your feet and not lift more than 25 pounds, as if that can happen. So the last mom that went through this, she thinks that hers was caused just from bouncing the baby on the yoga ball every night. She still had to bounce the baby on the yoga ball or it wouldn't go to sleep. Dad wasn't around to help, and it just perpetuated itself. So she's doing a lot better now, but it's ignorant to think that moms can just avoid those kind of things, because mothering is a 24/7 job, obviously. So musculoskeletal pain hampers our movement-related activities. Most of them are vital to caring for the children. So if we can help prevent this, we can help them be better moms. There are a lot of descriptions, like I said, of low back pain in the literature. Going back to the 1940s, mostly related to pelvic girdle, pelvic pain, pericardium, instability, SI dysfunction and syndrome, pregnancy-related low back and pelvic pain. So people are used to that, like I said, but not so much the upper back stuff. I found one textbook that glossed over and just said, some women may experience high back pain, and then it just kept going. And that was all it said. So that's what I want to change. What patients say when they come in is they say, oh, I have nursing backs. It's all this stuff, that usual breastfeeding stuff. And I said that when I was a patient, when I was still in school, and I assumed that the people would know what I was talking about, but they didn't. So again, getting this conversation going so that people say, oh, of course, you're nursing, you're doing this, you have internally rotated shoulders, anterior head carriage, and you're looking down at all the things that go along with that. We do know about postural fatigue syndrome, student syndrome. There's even telephone neck syndrome from doing this online. So, why not this? I think this affects so many more people. Upper cross syndrome, which has to do with tightness in one place and weakness in another, and that's one of the things that we'll focus on during the rehab part. So most common locations, this is everywhere. I mean, it affects the whole body. I see it in the upper body a lot. Interscapular area in the bra line right here is just classic. That's just the mommy spot. And that's where I want to walk up and just touch everyone when I see them like this. Almost always, somewhere between T5 and T8, things are going to be stuck in the flexion. Upper thoracic, ribs, superior shoulders, neck, head, lots of extra jaw issues afterwards. Wrists and hands, I see in almost all the moms. Again, a lot of that can just be education, teaching them about how to hold a baby without straining their wrists, or how to carry the car seat with their elbow instead of using this every time they pick it up. Lumbosacral pain, low back, you may or may not have disc involvement, SIs, glutes, piriformis, sciatica, lots of hips and groin and pubic symphysis, and then feet and ankles and plantar fascia. I see lots and lots of plantar fasciitis postpartum. So having a few tools to work with that is really helpful. But I have this in there mostly for educating practitioners who haven't been through it, to let them know, yes, you've heard of low back pain, related to pregnancy, but did you realize that it really affects everything? And it's very common for moms to complain of wrist pain or plantar fasciitis. A lot of practitioners don't know that if they haven't been through it. So this is kind of a recap of the flow chart that I did. You have two main contributing factors, hormonal and biomechanical, and then you also have practical, so decreased sleep and less time and less money for self-care. They're not going to be yoga class anymore or going into massage anymore. But you still have relaxin, oxytocin, ligamentous laxity, joints are less stable, more vulnerable, muscles compensate by becoming tight, so they're predisposed to injury. It was really interesting to me to see that it's not necessarily so that laxity and pain they're not quite sure of the causal relationship between that. People assume that that's what it is. And the studies really kind of conflicted on that. I was hoping that I would find a lot of really solid research. Some say it has to do with the altered gait and the joint laxity. Some show no huge correlation. Some show correlation between laxity on both sides, and some only show it if there's asymmetric laxity, if it's looser on one side than the other. But regardless, I've seen it again over and over in practice that it has to do with that predisposition to injury and the muscles becoming tighter. And that's something that's kind of counterintuitive for a lot of patients. They think, well, I thought I was supposed to be loosening up. Why do I feel so tight? And it's the muscles that are splinting and guarding and trying to protect themselves because they're responding to those joints that are irritated. And then, biomechanically, they have all of these awkward, sustained postures. So leaning over, again, the diaper changing table, co-sleeping, baby wearing, talking about what kind of carrier you're using. Are you using a Maya wrap with a 20-pound baby? How are you wearing it? Are you spreading it out? Maybe it's trying to switch to an ergo or a Mobi where you're spreading it out over both shoulders and both hips, trying to keep things even. I injured myself with a Maya wrap just because I didn't wear it out far enough on my clavicle. I had it too close to here, and I strained my scalings, and pretty soon you couldn't lift my arm. So, and I wouldn't have known that otherwise. So, being able to figure those things out. And then we also have some, other suggestive factors, metabolic factors, and enzymatic factors, and someday I'll learn all about that. That's from my naturopathic friend. This is a really interesting concept, though, and I think this is something that patients can really relate to. If a muscle stays in a shortened position for a sustained period of time, it's going to become shorter and tight. If a muscle stays in a stretched position for a sustained period of time, it's going to become weaker. So the classic example is side lying. They're keeping their arm up and away from the baby's head, but they're shortening their scalings. So pretty soon that whole side becomes tighter. This side is overstretched, might become weaker. Now, she may be going back and forth, but a lot of times they have one side preference and they're always doing it on the same side. So it's really easy for me to feel someone's neck and feel someone's shoulders and say, you're side lying nursing, aren't you? How are you holding your arm? Let's talk about that. How can we get that arm down? It's not that you can't bring the arm up, you just can't bring it down. So as a chiropractor, I'm going to adjust their first rib and their second rib, and I'm going to stretch their scalings, and I'm going to do some deep tissue work in there. Massage therapists, physical therapists, occupational therapists, people doing it different ways might have a different approach, but I think we can all talk about, how do we lengthen it? How do we try to reduce that tightness? Craniosacrally, of course, we're going to look at the thoracic inlet, we're going to look at the cranial base and the hyoid and all the tissues around there. But we also want to teach them how, again, to use proper biomechanics so that they're not exacerbating it. Tight pecs is another one. So they're constantly forward. One of the first things I look for in a patient when I'm doing my posture analysis is which way their palms face. Ideally, our palms would face our thighs at 0 degrees of internal rotation. Moms are more like 80 or 90 degrees because their pecs are so tight. They're internally rotating those shoulders. So not only do we want to see how tight they are bilaterally, but are they tighter on one side than the other? And giving them peck stretches, maybe more on the left than the right, depending on what you see, could be one of the best things that you can do for them. So I have kind of my top stretches that we'll go through again. The pecs pull the scapula up and forward, a little bit more forward actually because of the way that goes. And then the upper traps and the scalenes and the levator scapula pull the scapula upward. So you get from all of this, you get this forward and superior motion of the scapula. So what's weak are those lower traps, the middle traps. They're supposed to pull the scapula back and down. So we want to stretch those tight parts, scalenes, upper traps, levators, pecs, and strengthen the mid and lower traps to keep those shoulder blades back. So just simple shoulder rolls where they're really not squeezing together and really, straining or strengthening the wrong way, but pulling down and just waking up, activating these scapular stabilizers. So the Pilates class is great for this, where they're really focusing on that kind of stabilization. So if you've done this, I have this slide again for those who hadn't. You get yourself in all sorts of contorted positions. It's all about feeding the baby. There's Lisa again with both of them, leaning on her back and different kinds of pillows and propped up, seeing how much flexion is in her neck and how kinked over she is. Trying to do it at the beach in different places, toddlers, again, tandem, laying down. Look at that arm. That's what's going to cause that scaling in that upper rib stuff. Again, a toddler on the side, probably 30, 35, 40 pounds, in this kind of one shoulder sling and leaning over and trying to do things. These, again, too close to the scalenes in a way that might strain them. These backpacks are really heavy, and you carry heavy babies in them too, because they can get really big. One wing sling. Don't like these things at all. I could talk for an hour on that. And again, too close to the skin, you've got to pull it out over the mid-clavicular line. Holding goes along with the same thing. Obviously, shoulders. Moms just do this all day and they don't think anything of it. And then they say, why do I hurt? I said the same thing going into my pediatrician's, my back aches. And he's like, well, look at you. Of course it does. It makes perfect sense when you look at it. But, we just don't think about it. We're going about our lives and holding them in different ways. So, lifting, and this is another one where you really want to teach them about, as soon as the baby is old enough to climb, having them climb up on the chair, climb up on the couch, get close to them, and then lift them up and use your legs. Don't lean over and use your back. Don't pull them out here. And it's the same thing getting that car seat in the car, especially when you're in a hurry. You grab it, twist, and lift, and lean all at the same time. That's when you're going to have those, those really bad low back injuries. But having them way out overhead or far away from the body can really strain things. So another thing that took me years to figure out, and it's so basic, is my daughter was probably 5 or 6. Oh, Mama, up, I'm too tired. And I said, I'm too tired. I cannot lift you up. Oh, please, I can't walk. I said, okay, fine. I will lift you, or I can't lift you. I'll carry you, but you have to jump into my arms. And as soon as she did it, I was like, oh, this is so much easier. 1, 2, 3, jump. I didn't move my back at all. She propelled herself into my arms. It's so basic, but it helps so much. It was easier to lift her at 5 than it was to lift my 2-year-old because he couldn't jump in the same way. So it's just like, ballet dancers that can lift one person over their head that way. They're not using their strength. The other dancer is coming and jumping, propelling themselves up in the air. So simple things that you can do like that to try to prevent those repetitive stress kind of injuries. Leaning over all the way around the block, trying to teach kids how to ride a bike, won't help. And there's my mom, and my daughter. Same thing, you're hanging on those, again, those loose ligaments. Multiple children just makes it worse. The carry and the lean and, going about the day and they're crying and climbing off. So risk factors. If someone's had a previous history of back pain before and during pregnancy, they're more likely to have back pain postpartum. Longer sick leave, increased weight, decreased height, suggesting a musculoskeletal etiology, which seems like it should go without saying. Factors about work, the heaviness of their work, how much they have to bend over, constrained postures. I talk to people a lot about what they do in their jobs and what kind of activities that they do at home, not only now, but even growing up. Growing up, were you a gymnast or a dancer or a cheerleader? That makes a big difference in your ligaments lasting now. That might still affect you. A volleyball player who rolled their ankle 20 times playing volleyball, that's going to affect them. Oh yeah, I was a competitive gymnast for 20 years, or oh yeah, I was a professional snowboarder, and I ran into a tree. That matters later on. So lots of questions about those things. For some reason, younger moms tend to have more postpartum pain according to the literature. And then there's also a link with epidurals and anesthesia, and that's something that I'd like to look at more. And there's, of course, like you can some conflicting results with that. Here's the funny part, the sleep deprivation. Postpartum women have less overall sleep time and more night awakenings than non-pregnant women. Amazing.
But we need a gold standard trial on that.
Be sure that it's true. Because wake up in the night to take care of the baby. I don't know.
So you wrote this?
What's
You
that?
actually wrote a paper?
Yes. Oh yeah.
In 2003, no less, it took that long to figure it out.
This is true.
She just needed to go.
And that changes with sleep cycles and time. But yes, they don't sleep as much. And sleep is really important. It's really important. We all know it. Just like drinking water is important. But you have to say it. We have to acknowledge it. It's restorative for ourselves, our minds, and our bodies on many levels, not only recovery from fatigue, but actual tissue repair. And again, new parents sleep less total hours. Sleep tends to be broken into shorter chunks, not often able to get into the deep sleep, and that's when the real healing occurs. And there is a definite relationship between sleep dysfunction, fibromyalgia, chronic pain, depression, again, going into serotonin, and the whole other ballpark that we can't even get into today with short time. But I had a patient who started taking an SSRI, increasing her serotonin levels, and had this immediate change, and suddenly she dreamt again. She hadn't dreamt in years. And her muscle aches and her depression, all got better at the same time. It wasn't just the mood pieces. So there's definitely that, that interplay between all of those different things. Decreased self-care. They don't have as much time or money to take care of themselves. Too often they stop doing their yoga and their aerobics and massages and their pedicures. And we have unpaid maternity leave and decreased income, and a lot of times they don't want to make a baby. There's not the support set out there. So having a practice where you can invite the babies in, whether there's someone else there to hold them, or you have a swing or a bouncy chair, or you're just comfortable with it, it's okay, it's fine, bring them all in, let them play on the floor, having it be safe, having there be toys there. They appreciate so much having a place they can come and bring the baby and not have to worry about finding childcare. So, being able to accommodate that is really wonderful. And I always tell people, oh, it's totally, I'm so used to it. I'm used to having kids with my kids. It's too quiet here when there's my kids. It's fine. So, I have a really simple table that doesn't have lettuce, bells, and whistles, and springs and stuff on it so that they can just pop down on the floor. We are terrible in the United States about taking care of moms. And I hear patients from other countries remark on that. In Australia, they're still having home visits at 6 weeks or beyond that. And we really, after 6 weeks, we're pretty much ignored, at least in the traditional Western model. So there's also that lack of contact with with healthcare professionals, and that can aggravate both the physical and the emotional things. And they've shown studies in other cultures, when they have more comprehensive follow-up care, that mothers have better outcomes. So better physical and emotional well-being. I think that one was from Australia, New Zealand. I mean, it might have been Korea. I'll have to look in my. If anyone's interested in the bibliography for this, I might take that one. So what do we find? Exam findings. Now, of course, this again is going to be more geared towards a chiropractic exam, but I think a lot of it can be applied to different modalities. Postural asymmetry, having one shoulder high or one hip high, those palms facing backwards, like I said. Increased kyphosis in the thoracics, anterior head carriage, internally rotated shoulders. Their range of motion is limited and painful, both in their necks, upper backs, and low backs. Lots of joint restrictions, both the spine, the ribs, and the extremities, and lots of tight muscles. The muscles that I see the most, again, scalenes are huge, the upper traps, levators, splenius, everything's pulling up on the shoulder blades and forward, but all down along the spine. All the hip stabilizers and pelvic stabilizers. Pelvic floor work is hugely important. I'm so glad Michelle is going to talk about that tomorrow. And all the instructions around the hips, all the way down to the plantar fascia. So again, it's really head to toe, but I tried to put the ones I see the most in stars there. Going back to being able to help them fully. I think there's a big difference between someone who can take a client in, find out what's going on with them, what their symptoms are, what they're presenting with, and treat that there in the office. But I think you can really take that a step further by asking those questions and figuring out, what is it that's perpetuating that at home. This was really brought to light for me. I had, again, another patient who came in who we've been treating for a long time, and she got kind of better, but it just wasn't going away. It was her neck. And, I feel great after treatment, I do okay for a little while, but it just keeps coming back no matter what I do, and I keep coming in, and I'm doing the stretches, and I'm getting massage, and I'm doing all the things you're saying. I can't figure it out. I said, well, I don't know. We talked about it a little bit, and then she started telling me about this wonderful book she was reading that she just couldn't put down. We talked a little about the book, and I finished the treatment, and she left. And then I went across the street to grab my lunch, and I saw her there at the restaurant, and she was reading her book, like this. And, again, I went right over to her and said, I think I know why your neck's not getting better. Let's talk about how you're reading, how you're holding your book, and what about a book reader. So if we could just follow our clients around for a week after they come in, I think we know exactly what was going on. But the more that you can kind of dig and, observe and perceive and ask questions, if you don't know about their occupation, if you don't know what a viola looks like or how that's different from a violin, you're not going to be able to help them as much. So the more that you can learn about, not only are they an artist, but what kind of art are they doing? Are they doing really fine work where they're really, intricate details? Maybe tighter up here, as opposed to sculpture, or are they lifting metal? Asking all those questions, you're going to figure out where you need to focus in the body work. Because we don't have a lot of time to ask all the questions. So, being able to get a quick read on those things is really helpful. So as a chiropractor, I adjust upper and lower cervical vertebrae, thoracics, upper ribs, interscapular area, broad line, mid-ribs, lumbars, extremities. Now, I think there's a lot of joint mobilization that can happen in other modalities. I know more physical therapists are incorporating some spinal manipulation, osteopaths, obviously some naturopaths. But even without doing an actual adjustment, I think there's a lot of things that we can do in terms of, releasing some of those restrictions. And I think creating sacral therapy is a wonderful way to address that, because you can work on the fascia, you can work on the joint capsules and the connective tissues around there, focusing in a little bit more on the joints. Again, it's going to be like for inside, more like a gradual erosion than one big explosion, but you can still, with gentle, low force, low amplitude work, still open those up and reduce joint restrictions. Soft tissue is huge. I do a lot of post-isometric relaxation, stretching the scalings one way, having them resist against me, release, pushing it a little bit farther. I do that for the scalings and the levators, the Piriformis, and then the lateral rotators. And that's a stretch I'd love to show you when we get to the discussion part. I think we're getting close. some deep tissue work, active release, trigger point therapy, lots of TMJ specific work, and then finding other people, if this part isn't your forte, finding who you can refer to for work that complements yours, and I think that's a great way to build your clientele. Home and active care is huge. I always give people something that they can do in between times to try to maintain the improvement. So, figure out what's most important for them and give them just really little assignments. It doesn't have to be, 10, 15 minutes in a day. I try to keep it less than 5. If they will stretch their pecs, right after they brush their teeth morning and night and spend, 60 seconds doing it, I'm happy. I don't want to give them one more thing to feel guilty about, but I do want them to know, to empower them and show them, really simple, really easy things they can do. Because we all know it's hard enough just to brush your teeth in the first place when you're a new mom. You don't want to add a big long routine to it. So I really try to prioritize. Scalenes, upper traps, pecs, are most important, for most when they're having the upper back and neck pain. Sometimes it's more low back and then you can alter it depending on what they're doing. Stabilizing their scapula, stabilizing their lumbar spine. Teaching them how to find a neutral pelvis position and then maintain that by activating their transverse abdominal muscles. Since developing this, I got to take a really great class with Katie Bowman, and a lot of you were there as well. For anyone who doesn't know her work, she's a biomechanist who has applied a lot of concepts from physics and really hardcore science disciplines to anatomy and physiology, and the way that she talks about biomechanics is really fascinating to me. I feel like even having been from chiropractic school, I learned a ton from her. She has all sorts of YouTube videos and blog entries, and I barely scratched the surface of her work, but it's something that I really recommend. Katie Bowman, B-O-W-M-A. She's a good one to look at. She does a lot of work on pelvic floor, and the way that she described neutral pelvis, particularly, I found really fascinating. Yes. Restorative Exercise Institute is there. She goes around and teaches that. And she has a video on pelvic floor called Daphne for Women.
Yeah.
I also love Wendy Foster's here in town. She developed the Mama Pilates, and she does a lot of work with women recovering from birth, recovering from cesareans, doing a lot of, again, scapular stabilization and low back stabilization. I think that goes along really well, with the kind of body work that we're doing. And she also has a video that people can do at home if they can't get into the classroom if they're far away. And then gyrotonic is another really wonderful form of therapy that I discovered. I had someone come in, and for the first time ever, I did a posture exam, and I didn't have anything to write down. Her shoulders were even, her hips were even, her palms were at 0 degrees, she was straight ahead, she had no anterior head carriage, her curves were perfect. And I looked at her like, I've never seen anyone look like this, ever. And what do you do? And she said, I do gyrotonic 3 times a week. And I was like, I need to figure out what that is. And she said, I didn't used to look this way. And it's a really neat system. It looks like a Nautilus machine, but like from a Waldorf school. It's all and there's gears and pulleys, and it has to do with moving all of the joints through a nice physiologic range of motion. It was developed to rehab dancers who are hypermobile. And you don't want to push those joints past their normal range. You want to keep it within the normal range while the tissues are healing. So there's lots of exercises like this where they're keeping things neutral, but they're moving them through, and it's all about restoring motion in a way that doesn't increase instability. So I think it goes really well for both pregnancy and postpartum. Patient education, just teaching them how to lift, how to move, how to hold themselves is huge. Getting them to see in and out of the car, changing diapers, lifting older children. Someday I'm going to have a whole checklist of all the things I want to cover. Right now I just have it in my head, and all the time I'm saying, did I already tell you this? Did I already tell you that? What about this? What about that? But there's so many different things that we can look at and that we can help them with. This really helped me understand. So remember the picture, leaning over the bassinet and leaning over the bike and changing diapers. That is the pressure on our vertebral discs. So when you're lifting with good posture, it's only this much, but lifting with poor posture, it skyrockets. Sitting with poor posture is worse than sitting with good posture. bending forward, you're going to increase it 50% over standing straight up, laying down is, of course, the least. But with that much pressure on the disc, and then add in that being a car seat and twisting at the same time, and you see why they're going to be so much more stable. So sometimes just having a visual for them to see this, these are the kinds of things that you need to avoid to keep the pressure off the discs and help prevent injury. We can talk a lot about nutrition. I don't want to go too far into this today. I'd rather focus on more hands-on things that we can do in the body work piece. But again, anyone who's interested in any of this information, I'm happy to share what I have. We all know this stuff. Different nutrients that we need. I like seeing this though, the difference between non-pregnant and non-lactated and lactated, how much things go up, and what the increase is, percentage-wise. Lots of herbal and homeopathic and natural remedies that we can use, and I think, again, at a time when they're nursing, some women are going to be open to this for the first time ever, so it's a really great time to get people to embrace, the more integrated natural approaches. Lots of special considerations that I've, learned a little bit about through time. Again, I have more information on all of these things, but being able to recognize, I think, again, in a lot of ways that we don't fully understand, the postpartum time predisposes people to things. I see people that suddenly have rheumatoid arthritis, or they suddenly have fibromyalgia, or they suddenly actually have red, inflamed, swollen joints, and all their blood work is normal, and the doctors have no idea what's going on. There's something going on. A lot of women have hives postpartum for the first time, or other skin sensitivities. So there's definitely all kinds of things that can be researched that aren't being researched because who's going to pay for a study on hives in postpartum women. The first time I had it, I never had skin problems before. I was 6 weeks postpartum, whole body broke out in hives. Went home, next patient I had postpartum, hives, first time ever. 2 weeks later, another patient, hives all over. So I went and I Googled postpartum hives. It must be a thing, right? It's not a thing. But it is. It's there. And there's so many things like that that I've seen over and over and over again. So we need to talk about it and try to figure out how to get some of this information out there and hopefully how to help moms. Sheehan syndrome was something that I had never seen, and I had a patient who was having a really hard time with milk supply. She had hemorrhaged, and she was having a super hard time losing weight despite walking 2-3 miles a day. She was really weepy. I didn't know how to help her, but it was definitely beyond what I normally saw. It turns out she had something called Sheehan syndrome, where because of the hemorrhage, she actually had necrosis of her pituitary gland. So she wasn't producing enough prolactin, and that, it also affected her weight, it affected her mood, it affected her milk supply. So, of course, afterwards, oh, I should have known that, of course, there's so many of those things that we don't know, but I just throw that in there because I wish somebody had told me about it before I saw it. Lots of adrenal fatigue and thyroid dysfunction. I work really closely with naturopaths to try to help, not just, I really focus on the musculoskeletal because there's so many more pieces that we can look at. Abdominal diastasis, pelvic floor, a lot of the rehab and Katie Ben's work and the Mamalari's work and things like that. I do think a lot of postpartum moms have bone density loss. We do, really encouraging them to get bone scans and different things that we can do to help improve that. And plantar fasciitis, I've had some really tough cases of that, so that's another thing that I think we can. And it seems to be very different for different patients. Some patients do great with ultrasound, but terribly with a frozen golf ball, and other patients with the opposite. And same thing with the shoes, whether it's the minimal shoes or the more support or orthotics or no orthotics. There's just a lot of unknowns and kind of conflicting evidence that I've seen with that. I'm working on a handout. Like I said, I'm working on a checklist. I'm too much of a perfectionist about these. I know I need to just get it down, but I want to have a handout that can be easily distributed. They're just the top 5 stretches for nursing moms for most of. So for stretching the scalene, I have them turn their palm face down and sit on it Nice straight back, make sure that they're not doing this, but, not real exaggerated. Here's another thing that I learned from Katie Bowman, that not only do we need to think about, a neutral position in terms of the pelvis, so we want to rock the pelvis back and forth, I say think of your sit bones and rockers, rock back and forth, and then find the spot in between that feels the most stable, where you feel the least amount of pain and the least amount of strain. Ideally, the pubic symphysis and the ASISs will be in line in the frontal plane. But, it might be a little bit different for someone depending on their amount of lordosis or things like that. But finding that spot in between that feels the best, that's a great foundation for it. And, as a chiropractor, when I was first learning this, we kind of left it at that. Katie taught me something really valuable that I've been incorporating more and more. She talks about you have, the pelvic bowl, the pelvic floor down here, but then you also have the rib cage on top, and you really want those in line. And what some people do when they're trying to have quote-unquote good posture is they want to bring their shoulder blades back like this, but they end up jutting their rib cage way out. So they're doing this, and they're creating this kind of torque there, where the load is suddenly now not coming straight down on the pelvic floor and loading it in a way that it should, in a way that it's going to become stronger through time, but it's actually going to become weaker because it's not getting that same load, because this is shifting the whole physics and the lever kind of analogy that we talked about. So not only do we want to find this neutral spot with our pelvis, but we also want to make sure that the rib cage isn't jutted forward. So engaging not only those transverse abdominal muscles to hold the pelvis in position, but also just pulling that rib cage back in a little bit makes a really big difference there. So helping them find that neutral position. Shoulders back, not squeezed real tight together, but kind of right in the middle, just relax. Ears right over the shoulders. Ears up here, like this. And then the sternum up. Imagining a big hook right under the bra strap or right under the xiphoid process attached to a big hot air balloon in the sky. That's a nice, way to start that neutral position. So we, at Western States Chiropractic School, they talk about Ruger's relief posture, and this is the beginning of it, and then palms up, so that your pecs aren't internally rotated. That's nice and open. And that's an exercise that we give often. It's just coming up here into this position, taking that 3 nice deep breaths. Having someone do this once an hour if they're working with a computer out there, and your moms do that, after a long nursing session is a great place to start. You don't want to give them a lot of extra work.
Can the palms be resting on the lap or is it?
Yeah. Oh no. Resting on the lap is great. It's relaxed as possible. But it's just that counteracting this internal rotation. So, and then from that position to stretch the scalenes, we turn the palm face down and sit on it. And without rotating the head, you want to just bring one ear towards the shoulder. And it's the opposite shoulder from the hand that you're sitting on. That might be too intense for some people. It might cause pain going down the arm. A little bit of pull there is okay, but if it's particularly if the shooting pain are really uncomfortable, then they can just bring their hand up. The idea is to keep the shoulder away from the ear and down. So just nice and gently, and they'll feel that right there. Then from that position, and I usually guide them as I'm teaching them this, they want to rotate their chin towards that opposite shoulder and flex forward at the same time. And you'll feel the stretch go from the side of the neck back through the splenius and part of the upper trap and all the way down. The more that you rotate and flex, you'll get it all the way into the thoracic paraspinals and the lumbar scap. So these are the two that I do a lot with post-isometric relaxation. Does anybody want to be a model for that? So, table's a little bit lower. You want to just lay on your back. So I've done my adjusting, and I've done my soft tissue work, and I've done my cranial work, and releasing cranial base probably, and whatever else I'm finding in there. And then holding the base of the skull here. I swing my stool around. No rotation again. It's the same stretch that we just did, just bringing her left ear towards her left shoulder. And then I hold down her right shoulder with my hand, get it to a decent stretch, about the stretch. And then just gently push your head up into my arm like you're trying to bring it back to the neutral position and release. And that's just a deeper stretch than they can do on their own. So when they release, you're increasing the stretch just slightly. And it's called post-isometric relaxation because right after they've contracted, there's that refractory period where they can't contract again, and that's the time when we just increase the stretch.
You can have her exhale on the stretch.
Not necessarily. Sometimes I do, kind of depending on what we're doing, but sometimes I'll just, have them take a nice deep breath in. But mostly I'm focusing on, I want them to focus on the contraction and the relaxation and trying to add in the inhale, exhale piece of it. It's just as good for them. And then so from there, again, rotating that chin towards the opposite shoulder and flexing up a little bit. And you'll find, right where it comes to attention. And then here, just gently shrug your shoulder into my hand. So offering a little bit of resistance there. And again, you can increase that a little bit. So I do something similar for the Piriformis and the lateral rotators. For the first few years of practice, the only kind of Piriformis stretch I did, or glute stretch, was this one, where I was bringing them up to a 90-90 position, getting them nice and relaxed, turning this way, leaning in, feeling a stretch in your glutes right there, and then just push back against me, and here, she's turning that right and release, and leaning in a little bit further. And that's all I did. And then I went to my high school reunion. I won't say which one it was, but my chiropractor from high school is still in practice and still looks the same as he did those many years ago. And he treats lots of runners, and he did something similar to that on me. But then he came down and he came across the table and brought my leg across the table and did this. And I went, whoa, that's totally different.
That's
right?
yoga.
It's similar to something she'll get yoga, but having someone else do it on you, I can add in my hand on the ASIS here and my hand on the knee, so I can actually bring the femur, open up that ball and socket joint, bring the femur out of the acetabulum, and then turning my body this way helps to not torque the knee. So when I'm up here, it's too much twist on me, but this way you have the leg just 45 degrees across the body, holding this down and pushing this way, and then again you can resist against me, push back into my hand, and release. Get that a little bit deeper. So I just write lateral rotators. I think it's pelvic floor, it's IT band, it's glutes, gemellus and obturator, and some of those smaller muscles in there. Definitely feels below the piriformis muscle to me. Push it in, push back into me. And release. And you can just do, again, not an actual adjustment, but a little bit of joint mobilization there. Over. Don't tweak the knee. If it's too much for them, the more that you can kind of sit back, the less intense it's going to be. If you can, come out here, holding this part down so the bum is flat on the table, and then pushing the knee away. Push back into the hand. So those are the four main post-isometric ones that I do. Do they do that in massage school? Post-isometric relaxation? No. So this is depends. Thank you very much.
Thank you.
So we've got scalenes, we've got levators, upper traps, Ruger's relief, shoulder rolls. I talked a little bit about that. It's a nice way to open up the chest and strengthen those mid and lower traps. So bringing the arms up, head nice and relaxed, pulling down, and from here to here, nice and relaxed. You don't want to squeeze too tight together, but from here to the end, really focus on that down. That's where you really want to pull, and that's kind of hard to do. And I'll actually come up and feel, you may or may not be able to do this on yourself. These lower traps, we forget that we have them. I feel like the upper traps are pulling up on the scapula and the lower traps are pulling down. So they're having this constant tug of war. And these get so overactivated that they win and they take over. And these just give up and let go. So even finding them can be really hard. So I'll go in, put my finger right on that inferior angle of the scapula and say, pull your scapula into my hand. And they do this. and say, no, don't push from your shoulder. I don't want your shoulder to move at all. I want you to activate this muscle right under my hand and pull. And it takes a long time, and finally go, oh, there it is. And you can do that on yourself. If you can reach there, your shoulder will let you. Feeling that muscle right under your hand, engage, and pull that shoulder blade down. I don't know if you can see mine moving just a little bit, but that's the one that you want.
So don't what?
So don't push from here. You don't want to do this. You want to pull the scapula down by activating that lower trapezoid. So first you just have to help them find it before you get up. But then as they do this, they can feel it open. And you can do that backwards over a yoga ball, over one of those little Pilates balls, on a weight bench, something like that. But if they could do that even 10 times a day, doing it in the shower, or again after a long nursing session, that'll help stabilize the scapula, open up the chest at the same time. That's one of the most important things they can do. For Peck stretches, a lot of people are familiar with doing it in the doorway with both arms. I feel like that doesn't get as deep of a stretch in the pecs, and it's because it strains the shoulders too quickly. So I always have them do it one arm at a time. Nice straight body, not too far away from the wall. They can do it in a doorway, but still just one at a time. I would say we might even be a little far out. So 6, maybe 10 inches. And then the really important piece is to have the arm at least 3 different heights on the wall, because it's a band shaped muscle. So a little bit beneath, a little bit below, parallel to the floor, a little bit above, and a little bit higher. And that's really all it takes. 10, 15 seconds, but if they can do that twice a day, again, they do it right after they brush their teeth, feel it right in the armpit. What else? One I kind of just made up that a lot of moms really like. This table is a little bit too low for it, so I'm going to come down on my knees and imagine that I'm standing, that this is a kitchen counter, and just reaching out and coming back. Come to this side so you can see. Shifting the weight back and forth between my hips, and that can get down into some of these without overstraining, because you're not leaning too far over and moving the hips with that nice side stretch. Another one is just basic leaning to the sides, but then from there coming across 45 degrees and reaching over. So if they can just spend 5 minutes doing some of these, again, for those funny sideline positions, that can really help. Another thing that I talk about a lot is, well, if I'm not going to nurse like this while I'm lying down, how am I going to nurse? I don't, is there a neck pillow here? Maybe or just a regular pillow?
Can you use a baby?
Would this work?
Use a baby. Face
Okay, so imagine this is a Tempur-Pedic pillow. So I like to have a pillow that has the large hump on one side and then the smaller hump here. Okay, so we're going to have this be the large hump. And I'll actually get down on my table. And I say the biggest thing is to keep the shoulder away from the ear. So I bring the pillow down to my shoulder first and then lay my head down. And that makes it so that I really can't raise my arm up too high. If I get that down and lock it in, that's going to support, the pillow's going to fill in that space between my shoulder and the neck, support that in a nice way. You want to have the neck, really in line with your spine. And then that way, this is hard to do with a newborn, so with brand newborns, I might have them propped up on a pillow. But even 2-3 months old, I have to look at Lucy to remind myself exactly when it is that you can get them kind of on the tip of your arm without introducing too much lateral flexion into their neck. That's the thing that you want to watch for, because you want their spine, of course, to be nice.
Because I couldn't do that ever.
You couldn't do that ever? Just because of breast size?
Yeah.
Yeah. Even with upper?
No.
No? Okay. Well,
I'm very perky in all positions.
amen. And it depends on their body type, but a lot lot of times they can find either with the lower or the upper breast. There's a way to do it this way without having to have their arm up over their head or this arm up over their head. They want this one down as well. And then having their spine in as neutral a position as it can be. So that means having one shoulder on top of the other. I don't like it right on top because then that kind of squishes this one. So a little bit back, but then I want the same thing with the hips. I want one hip basically on top of the other, but instead of twisting the spine this way as that shoulder comes back, bring that hip back slightly. If they want to have their knees apart with a pillow, that's fine, but one over the other, not scissor like this, because that's going to cause the pelvis to do this. So a lot of moms end up doing this kind of thing or this kind of thing, and you know, teaching them, again, they can have the knees apart in this plane, but they don't want to scissor them or have them apart in this plane. Have everything as neutral as possible. And then it's other little things like, you know, how are you driving? How are you sitting on your couch if you're always laying on the same side of the couch, laying on the same side of your body with one leg over the other? Just switch it up, switch sides. Try to keep everything as symmetrical as it can be, and that will help minimize any of that, you know, extra imbalance that's there. Obviously, we're all going to be a little bit asymmetrical, but the more that we can keep it to a minimum, the better. So, any other questions come up? Specific stretches you want to see, things you want to try? Does anyone want to share what they find with moms, what they do with moms, what they're seeing over and over again?
You may have covered this, I'd step up for a minute, but I am distressed by the number of moms who are carrying their babies in these car seats that are not really ergonomically designed to begin with for carrying properly.
Do you mean for the babies, from the baby's perspective or the mom's perspective?
Well, both, but again, I mean, I try and influence mothers to get their babies out of the car seat and quit carrying them around like that.
Absolutely.
But second to that, because they're not going to listen to me necessarily, okay, so I don't have any control over whether or not they actually do it. So is there a way to educate them as to how to carry the car seat properly?
It's really hard to carry a car seat properly. Those things are so awkward. I think the more that we can keep it in close to our body, the better. The less that we're, you know, reaching out this way. I say if a car seat is in the middle of the car, physically climb in the car to get it in. Don't lean over from the sidewalk like that, but keep it close to your body. You know, pick it up, turn, climb in, lean over that much, get it in, you know, using your legs as much as you can. Another piece is the wrists. You know, they're doing this, and that can perpetuate all the wrist stuff that's going on. So, you know, alternating arms and then coming in and hooking with your elbow with a nice contracted bicep.
So do you think it would work better for them to have the handle up farther here?
I think if they're carrying it, rather than always using the wrist, you know, mixing it up a little bit so that it's one wrist and then the other and one elbow and then the other so that we're minimizing that repetitive strain. But I do think it's easier to just carry the baby. You know, getting used to having a carrier, having that baby close to your body, I think is better for the baby and better for the mom, particularly better than those car seats. I saw a dad wearing a car seat in the bookstore. It was the most ridiculous thing I've ever seen. It was like a big strap, and he had the car seat like literally on his hip with all the weight on one shoulder. The car seats themselves, I think, are 10 pounds.
Yeah.
So if you're going to be wearing them anyway, put them in a carrier to lose a few pounds. But
I'm all for the convertible car seats that go from 5 pounds up to like 70 pounds, and you can't carry those suckers even if you wanted to, so they just stay in your car all the time.
although I have been known to lift them and put them in a shopping cart if the baby's
Really?
asleep. And I don't want to wake them up. That was with the toddler that, you know, was 18 months, and I had to get the shopping done. You know, I maybe take them and put it in the car seat. But no, a lot of times when they're newborns and they're little, you can learn how to transfer them without waking them up. And it's not that hard to, you know, slip them into the MyWrap, slip them into the MobiWrap. So teaching them how to use those wraps or how to keep the MobiWrap tied on them so that they can get them in and out. And, you know, sometimes they think, oh, it's too hard, and that's what stops them. That, you know, you can refer them to someone who can help or help them right there in the house. That's great.
With the MobiWrap, I think one of the things when moms do those pre-tied steps, there's too much give, they're getting too much pull. I think it's so much better to get it half-tied, put the baby in, and then finish the tying process so that they at least get that support versus that.
Exactly. Are there good YouTube videos out?
Yes, but also just the back of the booklet, if they have the new Mobi with the back of the booklet, it's more like the kangaroo carries is the official kind of one,
But it does kind of, like I've seen a lot of moms with Mobirex tied really loosely, and I think it takes maybe sometimes somebody helping them with it once to show them just how snug it should be. I saw a mom the other day with an ergo with her baby's legs through the waist strap, like not through the holes. And I tried to offer her advice, and she stormed away from me at the mall, like I was evil. I've also seen babies, little babies, sideways in the ergos, and I always wonder, like,
It's a tough position to be in, seeing those things. I see babies with car seats like this all the time where I just want to do it.
but you also do another thing, you're talking about this constriction, and all of this stuff in the back and in the chest, getting off out of those types of nursing positions. Nursing all day doesn't have to be this way.
Exactly.
And that's really kind of getting to the root of it, is if they're doing this 10, 20 times a day, how can we get them to open up and support their bodies, which is, they did a lot of work on that the other day. But
Exactly.
Do you have wrist stretches and what do you do for wrist strengthening exercises? Do you do them?
You know, what I've had people do, not specific exercises, and it's not that I'm opposed to them, but I just haven't found a great one. For the most part, I say just be really careful about how you're loading it. You don't want to load it in too much extension or too much flexion if you're doing yoga, maybe doing it like this, or just wearing a light brace for a little bit of support, but also for that reminder not to take it to the end range. And I'll do a little bit of mobilization, if it's stuck, adjusting it, but I haven't found something that I feel really good about giving, so I don't know, but if you know,
I know a lot of really wonderful wrist stretches. I can turn later, or I can.
I do basic stuff like this, particularly with musicians that, have the repetitive stress kind of thing, but I hesitate to give those to moms because I feel like with the laxity, that might aggravate it, and so that's why I kind of, hesitated on that, but.
There's some Aikido wrist stretches that are really, I think they wouldn't be too strenuous, and you can find them on YouTube.
Yeah.
What about this one? You just rotate. That's what I used to do after doing a day's worth of massage,
Yeah.
and it kept them.
And my wrists are pretty loose and sloppy, and that doesn't feel like it's straining too much. So.
I'm just saying a lot of moms for acupuncture. I just, what kind of results have you given with that?
Well, sometimes with wrist pain, great results, although I have a 17-year-old in my practice that we're not getting much results, but I think there's a lot going on there. So right now, not a lot of success historically.
My friend who's a naturopath talked about, the whole nutritional component of this, and she was saying how when we're depleted nutritionally, our body will actually leach minerals out of our ligaments. And I think it was, I can't remember exactly all of the biochemistry of it, but it was something about cortisol and calcium, and when we're under adrenal fatigue, we can actually end up with more ligamentous laxity because of what the body is pulling out for something that it needs to build the cortisol. I can't remember if it's a vitamin or I need to clarify that with her, but making sure that they're getting proper nutrition can even affect things like what's going on in the wrist. And I know that there's Standard Process that makes a supplement called Ligaplex, which is kind of geared towards that. So again, that's not my strong suit. I'm focused more on the musculoskeletal piece, but that's something that I know it's a huge component that I'm interested in learning more about and integrating more.
I was going to say that my chiropractor in Indiana, me being a massage therapist, one thing that she recommended instead of intense stretches on them was just flexing, both your fingers and your wrists to be doing more, strengthening in the extensors, and that is also stretching them without really loading them with a lot of force, and then it's also creating some balancing work at the same time.
And then having the nice myofascial release and having some tissue loosen here, loosening.
Okay, I'll share it since we're doing wrist exercises. This is my favorite one. It's from something called White Cloud Technique. I'm a 10-year percussionist, so I had a lot of pain in my wrists and forearms. So how it goes is you keep your hand where it is, like rest it on the table or your other hand, and you move very slowly, one direction at a time, move the wrist around the hand. So you move the wrist up and to the side and down to the other side. And you might need to focus more on stabilizing your fingers. Eventually, when you nail it, you can actually gently spiral the wrist around the hand. It should feel really easy, nothing big dramatic stretching is going on, but it works deep inside the joint. And we want to do both of those directions. The first lesson when you're teaching this can just be around getting each of the directions, because the first time you try to go, it's kind of like a brand new move, maybe you've never done it before. But once you get it, it's so lovely, and you can even just then do it in your whatever little moments.
That
you
kind of
have
reminds me
through
what I was
the
saying with the
day.
gyrotonics, where it's, you're moving it through the range of motion, but it's a physiologic range, and you're not pushing it to extremes.
Right.
Yeah.
And it brings really lovely heat inside once you really get it down, the movements, and just make sure you're not tensing in your shoulder. Then you won't have to stabilize so much in the hand, and you can just do it in space. But it's my favorite all the time. Done an intensive study of wrist. Yeah.
Anyone have grid checks for plantar fasciitis?
FSM, frequency specific microcurrent.
They've also seen a big connection with thyroid and other balances like that, so.
Adrenals.
Yeah.
What I know is adrenals affects your calves, which then goes down, so then just supporting the nervous system so you're not so stressed.
It's all connected. That's what I always
Stretching before getting out of
bed.
bed is really helpful for me and just reducing the amount of pain first thing in the morning. But it doesn't really treat the cause, it just helps with the pain.
Well, releasing the soles trigger point can be really helpful. And acupuncture sometimes can be miraculous.
Amy, I see a lot of postpartum hives, and I think, and
Really?
I guess, are we alone? I mean, I see a lot. I think it's that histamine, that liver cleansing, that whole, it doesn't even have to be a hospital. I was loaded with every drug under the sun, but just that hormonal cleansing of the liver and everything shifting there. So a lot of times liver support just like clears those hives out real quick.
Yeah.
I see a lot.
I wonder if temperature and location, the weather has something to do with it as well. Was there a certain time of year that you notice it more in different climate?
I would say I think I have seen it more in the summer months, late spring and early summer. So that, and same thing with baby rashes where they're like, oh, it's heat rash or it's quickly heat or something like that. But yeah, so the liver piece I think is really important.
Thinking about car seats still. When I see people carrying babies in arms, when they bring them in that way, I give them a lot of praise. Like, oh, you know that it's much better for your baby to only be in that seat for the minimum amount of time, only in the car. You're so brilliant. It may be the only time those parents ever pick the baby up out of the car seat, and every other time they carry them in the seat. But I give them a lot of praise for being so brilliant in knowing that. When they carry them in the car seats, I go like, wow, that's so heavy. That's really so hard. They really ought to just stay in the car, don't you think? Or something like trying to just kind of make. And there's another thing that car seat manufacturers probably wouldn't agree with, because they're very clear about only the baby goes in the car seat, don't put any other little thing in there, although the babies are wearing clothes, right? But I tell parents that you can, and one of my students told me this trick, you can put a sling in the car seat, put the baby in the sling, get the baby lined up just in the right part of the sling, buckle them in, and then when you get to the store and they're asleep and you just have one thing, you just like, and you bring the baby out, and you can transfer the baby out that way. Now, I mean, granted, there's a risk with that because car seat manufacturers are very clear about, whoa, that could be dangerous. I don't know, I don't get how that's worse than a onesie, but that's,
This is coming up and over anything that,
Maybe the ring would mock them, and
Another thing that I check for a lot that I've seen over and over again is underneath the padding of the car seat, you have the hard styrofoam, and then on top of that you have the soft foam. And it used to be where they would both go all the way down the car seat, and then somewhere 10 or more years ago, they started stopping that soft foam about midway down, about right here on the baby. So when you feel down, you go down slowly, and then you'll feel this little dip or this little drop. And so it's really easy to reach under, fold up a little receiving blanket or a cloth diaper or something, and put it under so that it's nice and even all the way through. And I've seen lots of babies that have had issues right here that have hated being in the car, and as soon as we add a little bit of padding right there, it's gotten better. So there's some, some of the nicer brands or whatever that have it all the way down, but most of them don't. So that's another good thing to try.
Just that your idea is a brilliant one. There's a new baby carrier out there called the Baby Content. Has anybody seen this one?
No.
It's the Mobi without the long wrap that is the same idea, and you actually could lay the baby in the proper position in that wrap in the car seat, and then all you would have to do is to duck your head in and put it over your shoulders and lift the baby out, and then take your extra piece and wrap it around. But I would go to the website and see this thing. It is like a genius. Baby Catan.
K-A-T-A-N.
It is, I mean, the Mobi, let's face it, that Mobi takes a lot of time to wrap, and I haven't mastered it yet. But this other one is you just put it over your head and voila.
So and it has like the extra pieces like a tube, is that?
Yeah, it's just basically two tubes that come across your shoulder like this and wrap around, and then an extra piece that serves as the little container that you fold it up and put it into, and then the baby fits in just like they would in a Mobi. And it comes in different sizes, so you can buy the right size for your body length and arm length, etc.
Yeah. See that.
I didn't think I was going to die to do a carrier.
And it is so easy to use.
I do, Heather asked about pelvic stretches. Are you talking more about gluteal stuff or more pelvic specific? So I think the best way to stretch piriformis, and this is for anyone, but it helps a lot with pregnancy. Most people are used to pigeon pose, or they're used to laying on their back and, pulling this through that way. But when the belly is big and in the way, it's really hard to stretch that. So I have them, again, sit up like you started with the other stretches, doing those pelvic rocks, and then bringing 35 degrees across the body. You're pulling on the knee and, maybe pushing down here a little bit. But you can't, if you come down slightly, you can get it a little bit more. And you'll feel that like more down around. But basic adductor stretches, side to side. Psoas is another really good one. Again, this is not rocket science, but the way that I do it is making sure that the front knee is over the ankle, and then the back leg is straight, but the back foot is angled out about 45 degrees. I'm feeling it right there. Really similar to a warrior kind of pose, but having that 45 degree angle, I think helps a lot. And you can, turn that a little bit one way or the other. Doing that on both sides. And again, every time I show this, I'm like, I need to stretch more. So those are the main ones. But then I do refer out for specific pelvic floor work a lot too. Anytime they're having stress incontinence, if they've had tears, if they've had episiotomy, if they just had a difficult work and they're, getting ready for the next one, making sure that they get that piece of rest. I'd like to start doing more of that in the office too. I need to hear what Michelle has to say first. Any other topics that people want to cover?
What more can you say about helping moms sort of organize their physical surroundings, for baby care activities or other care activities that can help them kind of
That's a really good question.
give some more stability?
Paying attention to how far over they need to lean. So setting up the diaper changing area. If their changing table is this high or higher and they can really, be neutral through here, that's fine. If their changing table is beneath that level, down here, they really want to think about either pulling up a chair to it or lunging like this or spreading their legs like this. I have, when I come up to the front of my office, my desk has a high part, kind of the countertop where patients will write out checks, and then there's a lower part. And oftentimes they come around to the high part, and I come to the low part, and I'm leaning over like this, and I say, don't watch what I'm doing, this is terrible. And I catch myself, and then I pull up the stool, and I say, you don't want to lean and hang. But I can come around to the counter and do it. Even that, I'm leaning forward a little bit, so I bring my legs down like this, and I use that as a teaching moment of, okay, look, I caught myself. I'm leaning over. It's only for a minute, but if I do this 20 times a day, it's going to add up. So, just letting them know that there's little modifications that they can make, keeping that spine neutral. And you really want to teach them the difference between flexing forward and using their lumbars to get this forward motion as opposed to flexing from the hips. And this is, again, something that wasn't obvious to me, even after going through school. I didn't get this until, a couple of years into practice, that it's a lot different to use this as your axis of rotation as opposed to this, and a lot less stress on the body. So really sticking the bum out, keeping that low back nice and flat. And past this is too much. So that's when you want to figure out how can you lunge, or use your legs, use your quads. Again, just like sleep is important, water is important. We all hear this, lift with your legs, but really it saves so much strain here. So figuring out how to do that, and then figuring out which activities you're doing in your life that aggregate it. So loading the dishwasher, leaning over, going from the washer to the dryer, and catch myself again. Disc herniations happen with loading and flexion and twisting at the same time in particular. So going from the washer down to the dryer and back up again and moving things and doing that kind of thing. So I really want to take things out, turn, come down, put them in. And it takes that little extra moment, but that might make a huge difference. So another exercise that we do a lot is, again, in finding that neutral pelvis, rocking back and forth. You can do this seated, you can do it standing, you can do it laying down. Anyone who's having chronic low back pain where you're worried about instability, helping them find that. Again, when you're standing up, a true neutral pelvis has the ASIS and the pubic symphysis in line in the frontal plane. You don't want the ASIS back, and you don't want it forward. That's not neutral. But if you can find that, then engage those lower abs. So, I don't know about you guys, but when I went to my first Pilates class and they said, engage your core, I had no idea how to do that, or what they were talking about, or how to find it. And they didn't come and show me. But in the way that we teach it was to pretend like you're blowing up a balloon. And actually literally take a breath in, and there it is. Those are your transverse abdominal muscles. And that little piece, and at first you have to do that every time. But pretty soon, you can just find it and think about it once you find it. It's the same thing with this. You might have to teach them at first, find that muscle, and you press on it and activate it and train them. No, that's not it. There, that's it. Now you have it. Now you can do it without that. So finding that neutral pelvis, engaging it and locking it in. Then doing your transitional movements. The things that get people are going from seated to standing, standing to lying down. One of the worst things I ever did to my back was I was laying in my bed, which was really low to the floor, and my 18-month-old came up and mama picked me up, and I went like this and completely spasmed and couldn't move for a long time. So, and I see people on my table doing that all the time, where the babies are running around and they want to reach over and pick them up and bring them out. I say, no, let me do that. Don't. So I'll come along and I'll get the baby and I'll come down and I use my legs and I turn my body and I put him there. You don't want to twist and lift and load all at the same time. And it seems really awkward to make yourself do it, to find the neutral pelvis, engage the muscles and lock it in. But if you make yourself do that consciously throughout the day, you find yourself just doing it automatically. And so pretty soon, before you pick up the car seat, you've already gone, okay, now I'm going to do that. I'm going to maintain that the whole time. So that when they're laying in bed, and this is pregnancy all the way through, this is really anyone who's having low back pain or instability issues. Before you turn in bed, before you get out of bed, you do the same thing, rock back and forth, lock it in. Laying on your back, I don't know. Find it, lock it in, then keeping those muscles activated, roll, slide your legs there, use your arms to push yourself up as opposed to coming up from the abs, and that can be really protective for them, and that can be a huge self-care piece when they're recovering from an initial injury. So, but talking about doing that, it's not, it's one thing to do it when you're completely focused on it, and it's another thing to have it be automatic where it's just part of your daily activities. So, teaching them to do that in a way where they can really focus on it so that it is automatic before they're loading the dishwasher or the dryer or you're doing the car seat, things like that. And then again, showing them when a baby's, as soon as the toddler is old enough to jump, teaching them not to do this, but to do 1, 2, 3, and practicing that and making sure that they get it and why, and then they can apply it to other things. So, pubic symphysis dysfunction is another one that, until I went through it myself, I didn't know how to teach people about it or how to talk about it. I had a lot of patients tell me, it hurts here, it hurts in my groin, it hurts when I roll in bed, it hurts when I get in and out of the car, and I said, well, that's pubic symphysis dysfunction. I knew that. Dysfunction.
What is it? It's out?
It's irritated and it's moving too much. There's a continuum between full-blown diastasis or separation and just a little bit of irritation. So sometimes it's stuck, sometimes it's hypomobile, and we can adjust it. We like to find things that are stuck so we can make those move again as chiropractors. When it's hypermobile and we have to stabilize it, that can be a little bit trickier. So a lot of times, our options are to give them a belt to stabilize it. I didn't get to hear Heather, so I'm not sure, I don't want to totally repeat what she did, but I always talk about the pelvis as a 5-joint complex. So even when the pubic symphysis in the front is not moving right, it could be a function of the hip joints. These are the hip joints, and these are the SI joints back here. You have all 5 of those joints working together. So sometimes working on the SI joints or working on the hip joints will help release it. So if it's not moving enough, getting it moving again, working on the other joints around it, stretching, the glutes that I showed you, and the lateral rotators, and the piriformis, and the adductors, and the abs, all of that can help. If it's moving too much, stabilizing with a belt is sometimes, the only thing that we can do in protecting them. But then, again, learning those things that they might do at home that are going to aggravate it. So some of these I didn't know until I'd been through it, and suddenly I was like, oh, this is what people were talking about when they said they felt like the baby was going to fall out or like they were going to break in half. Like, it's a real feeling of vulnerability. And you realize quickly when you're that vulnerable how many things you do that aggravate that spot or pull on that spot you never knew about. So the drawer underneath my oven is sticky. It's probably all the grime and gross stuff in there and too many pots and pans and it's hanging down. So I always use my leg to push it in, and I didn't realize. And suddenly I went, whoa, I better tell my patients with pubic symphysis dysfunction not to push things. So people push that drawer, they push laundry baskets on the floor. Another thing that I did is I start to open the car door and then I do the rest with my leg. I had no idea I did that. I wondered why there was a big crack in the little holders in there. And then finally I realized every single time I do that. So, teaching them, really pay attention to what you're doing and how you might be straining that, and be really careful about anything that engages the adductors or the abs that might be pulling on that.
And do you have any exercises for people, like opening or closing exercises for that?
More the neutral pelvis and the stabilizing and that, transverse abdominal low thing, lower ab activation. The other ones that we do are lumbar stabilization tracks, depending on whether they like flexion or extension. One is, I'll show you, called the dead bug track. We have a whole stabilization thing, and I just pick the two that I like the best, and I like to keep it simple. So the dead bug one starts, then we'll come back and we did this flashes today. So finding the neutral pelvis, locking that in. Their back's not going to be flat on the table. They should be able to slide a hand under there. There's just enough lumbar curve there to do that. And then engaging the abs, slowly bringing one foot up and then the other foot up, just a few inches. you want to do it in good form and without losing the amount of curve here. And then as they get better, they lift it a little higher, and then they can add in the arm at the same time. And again, it's all, so if they like lumbar flexion better and are doing better with that, particularly if they have a lot of pain with extension, this is a good way to start. And, working their way up. If they like extension better, then we do hands and knees. Knees right under the hips. Wrists right under the shoulders. No, I'm all saying, oh my goodness.
I'll tell you what I did while she's setting up. I just really think about just balancing those adductors and abductors, and so I tell moms to make two fists and squeeze in 1, 2, 3, 4, 5, squeeze out 1, 2, 3, 4, 5, squeeze in, and it just kind of helps to reset the neurological flow to those. Or you can do the chair, squeeze in, squeeze out.
How many times per day?
I told them to do 25, like do 5 squeeze in, 5 squeeze out, and try to do it 2 to 3 times a day.
Great.
You can do it while you're on your back, if you really can.
How do you use with basketball?
Yeah.
To squeeze, and sometimes that adjusts.
Some little Pilates balls are really nice.
Yeah.
So for this one, again, finding that neutral position, holding it, locking it in. Another thing, remember that the rib cage piece. A lot of people have their rib cage too far down as they're doing that, so making sure that they pull that up a little bit right at the end. And then for this one, is slowly maintaining that, keeping all of that activated. And you're basically just training yourself to keep your core engaged as you're moving your extremities so that it becomes kind of hardwired. And then as you get better at it, adding in the opposite. Oh boy.
So this would be good for really any pelvic instability, not specifically the pews.
Yeah, pelvic and lumbar, but remember that whole 5-joint complex. Making sure that the hips are moving evenly is another really important piece. If the hips are restricted in internal or external rotation, a lot of times one will be restricted in external and the other is internal. And that might be because they sat like this for a long time, or because of the way that they sleep, how they're holding themselves. But helping to balance that out. And if you're not adjusting, still, like I said, doing some long axis distraction on the hips, trying to release any restrictions in there can help a lot. But I like the activation, the strengthening of the abs, which connect down to the pubic symphysis and the adductors. But you have to be careful with the adductors too. One of the adjustments that they teach us is that same, squeezing in, and then as you release, the doctor goes like that. And someone did that on me, and it was like a firecracker. It just, and that can be really too much. So, just being careful that all of that is done super gently. Even when they're doing it, themselves, that's fine. But, if a chiropractor, a guy who's never been through it and depends on his muscles comes in and says, oh, let's just adjust it then. That's really not a good problem.
I've had it adjust a lot just by they press. And how myself.
Yeah, if it's really unstable, that can definitely happen.
Yeah.
But,
I wanted to say also that a chiropractor told me years ago after having SI and pelvic instability, and I wore a belt, when you get into the car, you sit down and then you rotate in. You don't step one leg in and then expect that leg to hold the whole rest of your body.
Right.
Boy, that made a huge difference.
That's a really good point.
And I've done that pretty much ever since. I mean, I forget when I feel really good, but mostly, that's,
and it's those million little things that we do, throughout the day. That's, again, why I want to be able to follow people around and say, that's where you're doing that. That's where it's coming from, and being really aware. We had someone come in once who had issues with her pubic symphysis, and we worked on it and treated her, and she said, is there anything that I can't do that I normally do? Any restrictions that I need to have? And it was a different doctor in the office that talked to her, and I don't know exactly what she said, but I think she basically said, just be careful and take it easy and don't kickbox, and But she went and took her dog for a walk that night, and the dog saw a squirrel and took off and went, and it completely, aggravated everything. And she was hesitant. She was really mad at us for not telling her that, not to walk her dog. So, I don't think that happens very often, but we can't predict the future, obviously, but the more we know about things, if someone mentions their dog, I might say, well, how big is your dog? And are you walking them? Or, if they're a 90-pound dog that's going to take off.
Are they walking you?
Then, really be careful. And if they start to pull the leash, let go. Don't let them, don't brace yourself here and let them go that way. And then something else, you asked about pubic symphysis, was that you or somebody did? Pubic symphysis dysfunction. There's a website written by a patient who is like 30 pages of information on pubic symphysis dysfunction. It's really, really informative, and it's at Plus Size Pregnancy. PlusSizePregnancy.com, and I think that there's a hyphen between plus hyphen size pregnancy.org. Yes, thank you. And then pubic symphysis, and all kinds of self-care things and etiology and things that you can do to treat it. But yeah, she talks about how it's a continuum between just a little bit of irritation on one end and separation.
I'm thinking about how a lot of these things really have their roots in a lack of body awareness. And I think of one of the common features of the postpartum experience is a loss of self. And I wonder if you have anything to say about that.
There is a total disconnect, absolutely. Yeah. And I feel it as a practitioner too. A lot of times I'm working on someone and they say, this must be really hard on your body. I don't even feel it anymore. And I don't, because I'm so focused on them. In the same way that when I was waiting tables, I didn't feel my own hunger. I was feeding other people, and I could work an 8-hour shift without a break and not eat because all the focus was outside. So as a practitioner, we have to be really careful about it, particularly as practitioners who are also moms, who are taking care of patients all day and then going home and taking care of kids all night, learning how to reconnect with ourselves. We encourage our patients to do it, but are we giving ourselves the same thing? And helping them be aware. And conversely, people who are hyper aware of their bodies, that's kind of a blessing and a curse. People who've done a lot of yoga or who are practitioners, they might feel every little ache and pain because they know what muscle it is and they can envision the anatomy and they're so aware of it. So, we also have to find the right amount of disconnect too, and that can be a really tricky balance, and I think it's something that's really different for everybody. But yeah, absolutely. And letting them know, again, it seems so cliche and it seems so obvious that, they have to put on their own oxygen mask first, and if they're not taking care of themselves, they can't take care of the baby. But moms need to hear that over and over and over again. It's okay to take a break. It's okay to ask for help and take a walk and take a bubble bath and get out and, or do it with your baby. Find a way to incorporate it so you're maybe not having to leave them. But taking care of yourself is really taking care of them and reminding them of that and finding, and sometimes they can't see it. They can't see it. They're so in it and so in the trenches and, oh, there's no way, and oh, there's no time. And, what if we did this? What if we did that? I had a mom the other day. I just can't exercise. There's just no possible way. The only time I have is when I'm at the park during soccer practice and I've got the toddler and I can't do it. So we thought of all these different things that she could do while she's with the toddler and while the toddler's playing, the kids playing soccer, and how can she incorporate that into her life and making it a priority and just reminding them of that importance. But yeah, absolutely, that's a really, really tricky thing for people.